if you are a benefits professional, you probably get Medicare questions every now and then from employees or their spouses who are turning 65 or approaching retirement, and you most likely, you want to help them, but there's this fine line of compliance or non-compliance. I don't want to incentivize or coerce anybody. I don't want to give personal advice. So I'm going to answer the most common questions about Medicare in this video, and I'm going to outline how you can help employees on a more structured basis and argue why it makes sense to put a proper Medicare education strategy in place. You do it for your core benefits, it makes sense to do it for Medicare. So, real quick, let me just paint the picture a little more vividly for you. A Medicare education strategy is going to address your group plan's biggest concerns when it comes to cost, but you're going to do it in a compliant and win-win manner. I'll explain why. You're going to help employees and their spouses with the most daunting, and this is the key word, overwhelming. Most everyone I help with Medicare uses the word overwhelm in some form, which is the most appropriate word for it. It's crazy. But it's the most overwhelming personal finance event, decisions they will ever face, that anyone will ever face. This stuff is nuts. You're going to save some employees for whom it makes sense to hop into Medicare at age 65. You're going to save them a lot of money, and they're going to end up in a better health plan. No offense. And I would argue that by helping people with Medicare and being a trustworthy resource, you're going to boost satisfaction among older employees and even younger employees who may need help for their parents. So you can implement this. This is key. You can implement this very quickly in some way, shape, or form. You can do something at little to no cost. And I'm going to show you 4 ways to do it. 2 are free, 2 are paid. So employees and their spouses are thinking about Medicare when they turn 65, whether they approach you or not. Medicare sends them information. They get a big old packet that's like this god-awful 100-some-odd page tome of everything Medicare, and bless them, but it's not laid out very well. It doesn't make much sense. People are bombarded with predatory marketing messaging, phone calls, junk mail, Facebook ads. People show up on their doorstep even from people trying to sell them something. And just, anyway, it's not good. It's not good out there. So, understandably, they go search for information and they try to find, this is the key, they're trying to find a trustworthy person, resource, website, whatever. Because they, rightfully so, don't trust anyone who's reached out to them proactively. Maybe even the government they don't trust. Little snapshot here of, just did some keyword research earlier today. The term how to apply for Medicare gets just shy of 20,000 searches on Google per month. And if you were to advertise against that word so that, whatever your web pages would show up at the top of Google, you'd pay up to $11 or so just for the click, just for someone to go on your website, not even to do anything or sell anything. So that if that didn't tell you how lucrative it is to get someone when they are turning 65 and convince them to work with you and sell them a product, I don't know what does. So bottom line, it's overwhelming. It's super hard to find trustworthy help. You're the employer. You can fix this. You can give employees and their spouses a trustworthy and complete guide to Medicare, even though it's not technically your job. So if I've convinced you to do something about this, here is the first fork in the road. We'll get into a little bit of how Medicare works here. So if you are with a group with 19 or fewer employees, and that's just employees at the company, it doesn't have to be 19 people enrolled in a group plan or whatever, 19 or fewer employees at the company, this is the easy answer, the easy outcome. Someone turning 65 who's Medicare eligible needs to enroll in Medicare right at age 65. That's because group coverage becomes a secondary payer, and so it's really of no use anymore because Medicare, when you properly enroll in it, is a complete health insurance solution. Just drop the group coverage, hop to Medicare, make a decision within Medicare for whatever budget and healthcare needs, good to go. Groups with 20 or more employees, this is where the opportunity really lies. It's where it gets a little more complicated though. So someone turning 65 who is eligible for Medicare in a group this size can either enroll in Medicare at age 65 or wait until they lose group coverage. either because they're retiring or their spouse is retiring who has the group coverage, or they move to part-time, whatever it may be. It's their decision. And most people just assume, well, I'll just wait till I retire. That's the right thing to do. That is the wasted opportunity here. And I'll show the numbers behind that in a minute. In this situation, if someone has group insurance and they keep it and they enroll in Medicare, group coverage remains the primary payer. That's going to keep that first slot. And again, just to finish out this table here, it might be worth keeping group coverage, but to assume that it's the right choice is not always the right choice. So, the Medicare basics. So there are tons of parts. It's very complex. The next couple slides, I'll lay out what I think is the most simple way to conceptualize it. So these under 65 health plans, whether it's group or Obamacare, whatever it is, we tend to think about it as all-in-one coverage, right? For lack of a more in-depth way of describing it. Medicare gets you to the same end result. It's just the different parts of Medicare are responsible for different pieces. So Part A, for example, is inpatient coverage. Part B is outpatient coverage. Part D is easy, D for drugs. So you just combine it all and you get the same end result. There are 2 steps to a complete Medicare enrollment. It's not just go to an insurance company and that's it. You got to sign up with the government first. That's the baseline coverage. So that's Part A and Part B, also called Original Medicare. And that's where that red, white, and blue Medicare card that you see on TV everywhere and other places, that's your identification if you are enrolled in Original Medicare. Once you have that, then the door opens to all the other options, be it Medicare Advantage, a Medicare Supplement, a Part D drug plan, and the vast majority of people on Medicare have some sort of private coverage on top of the Original Medicare. So to think about it in a metaphor or analogy, I'm not sure which is the appropriate term here. Think of it as a house. So you're building a house, you need a foundation, and a little overdone, but it makes sense. Part A and Part B are the foundation. You can't build the house until you got that in place. All other parts of Medicare are the house that go on top of the foundation. And you can choose, generally speaking, one of 2 houses. So the first house you can build is the more expensive house, at least on a monthly basis, but it's more cost efficient. So this is a Medicare supplement. You might have heard that this has very low out-of-pocket maximums. That's true. The other option, the other house you can build is a Medicare Advantage plan. And that's a lower monthly premium, but it's less cost efficient. So higher out-of-pocket maximums, network restrictions, things like that. Frankly, more akin to the group plans that we're used to. So here are the numbers. And this goes back to the decision of an individual. Okay, I work for a larger company, excuse me. I can choose to either hop into Medicare or keep my group coverage. What should I do? And this is the key question that I think most employers miss and most employees miss. They don't even consider this question. Take a look at what the options are. These are national averages. They're not absolutely dialed in, but it's a good guideline. These are 2024 figures. If someone goes with Original Medicare with a supplement, so the more expensive house, or more cost-effective, cost-efficient house, for about $350 a month, you're getting a medical out-of-pocket maximum of $240, not $2,400, $240, which is stellar, obviously. The out-of-pocket maximum for prescription drugs is a little bit higher, but that's coming down every year, which is great. So about $3,300, very worst case, if it's like a brand name drug, chemotherapy drug, something like that. Network, no network restrictions. So with Original Medicare and a Medicare supplement, you can see 98% of U.S. healthcare providers. So that's any provider who accepts Medicare in the country, a center of excellence, some one-off doctor in a state across the country, doesn't matter. If they accept Medicare, you can go as long as they're accepting new patients, obviously. Pre-authorizations, at least for medical services, not necessary. Referrals, not necessary or required with Original Medicare. Not to use superlatives, but I'm going to use one. Original Medicare with a Medicare supplement is the best health insurance you can get in this country, and it ain't even close. Medicare Advantage is, again, the lower priced alternative. It looks, talks, feels, acts a lot like group coverage, a lot like under 65 coverage that we're all used to, but you can see it's about half the price. Again, these are averages, generally speaking. The average out-of-pocket maximum, national average, of course, about $5,000 a year for medical. That prescription out-of-pocket maximum is in addition to that, again, that $3,300 or so. Networks, yes, there are network restrictions, but most Medicare Advantage plans these days are PPOs. There are some HMOs as well, obviously a little more restrictive. Pre-authorizations for medical, we're going to put yes back in that column. Referral requirements, most likely yes on a Medicare Advantage plan. So all to say, these are the options for Medicare. And if you, obviously I don't have your group plan specifics in front of me, but if you take whatever summary of benefits you got and compare it with these two options here, you may find that, hey, one of these is really attractive looking. And this is the missed opportunity. So again, while you can't incentivize or coerce employees to move to Medicare and off your group plan, you can darn sure educate them. And who doesn't want to be educated by a trustworthy source? Everyone I help who's enrolled in Medicare has said they wish their employer did more to help them with these decisions. So it doesn't hurt. So the next question, naturally, what about other benefits? Dental, vision, life, whatever. Medicare replaces only medical and prescription drug coverage. Some Medicare options by default do not cover dental and vision. Medicare Advantage plans for the most part do, but employees and spouses can stay on those other group products, dental, vision, life. At least from Medicare's perspective, it's okay. Obviously, you're the group, you're the administrator, whoever you are, you make the rules. But from Medicare's perspective, it's okay to just carve out the medical and prescription coverage. So what if someone wants to enroll right at age 65, whether they have to, if you're with a smaller group, or they just want to because they've analyzed the options and they say, hey, Medicare's a better deal, I want it. So this is the first opportunity to enroll. This is called the initial enrollment period. And it's all centered on the 65th birthday of the individual we're talking about here. You can do the enrollment 3 months ahead of time, and that'll be locked and loaded, ready to go. Coverage will start the first of the 65th birth month. So you're born July 17th, for example. Coverage would start on July 1st as long as you did the enrollment far enough ahead of time, within that 3-month window beforehand. If the individual enrolls in their birth month or up to 3 months after, they're still within that window without incurring a late penalty, but coverage is going to start late, obviously. So usually the first of the next month. So what if someone wants to delay or does delay, or they've made the decision to delay without really knowing that they have? That's okay if they work for a group with 20 or more employees. Like I said before, the key here is they need to enroll in Medicare as soon as they know what the last day of group coverage is going to be. Again, for whatever reason, they're retiring, or there's a reduction in force, or they're moving to part-time, or their spouse is retiring, whatever. There's technically an 8-month window after the group coverage ends in which they can still hop into Medicare and not incur a late enrollment penalty, but I've never actually seen a situation where it makes sense to do that. Just to keep it simple, as soon as the group coverage ends, or the group coverage is going to end, go ahead and do the Medicare enrollment, get it ready to go so that the first of the very next month, that Medicare coverage can start. So what if someone does not want to enroll in Medicare at age 65? A couple things to keep in mind. So most people who do delay and can delay, they go ahead and get Medicare Part A at age 65. That's the inpatient hospital coverage. It's, again, going to be secondary to group coverage. It doesn't cost most people anything, so it doesn't really hurt to have it. I've never really encountered a situation where it's made a huge difference, but most people go ahead and get it for whatever reason. That's like the conventional wisdom. One caution, though, if someone has a health savings account, if you've got a qualified high deductible health plan, if someone's contributing to one, or you as the employer are contributing to one for an employee, they need to stop contributing to it, because you can't contribute to it once you're enrolled in any part of Medicare. It's safe to stop the contribution 6 months before any enrollment starts. How to do the enrollment. This is a key factor here, this first bullet point. If you've got employees who are already taking Social Security retirement benefits before age 65, they're going to be automatically enrolled in Medicare Part A and Part B at age 65. Social Security is going to do that for them. So be aware of that, make them aware of that, because that can, if they want to undo that, it gets very messy. But in all of the cases, if someone isn't taking Social Security retirement benefits, they got to do Medicare enrollment manually when they want to do it, or otherwise have to do it. You can do it online, of course. Here's a link to the website to do that. Phone number for Social Security to make a phone appointment. They'll help you do that. You can go to the local Social Security office if you want. And a note for HR folks, if someone delayed past age 65 and they need to enroll in Part B or all parts at some point, you're going to need to help them complete a form. It's not very long, but it's a CMS form L564. You can just Google that. The first result is going to be from CMS, and you just help them fill it out. You just confirm, hey, this person had group coverage from X date to Y date, and yes, I confirmed that they did have this coverage and they were qualified, that kind of stuff. So resources, if you want to put something in place to help people, help employees, spouses, parents of your other employees with Medicare, there's a web page on CMS's website that has a nice assortment of resources just to refresh your memory. And they've got some printouts. It's not very consumer friendly, but it is complete, technically speaking. There's some insurance agencies out there who've invested a lot of time and money in their websites and YouTube channels that do a pretty good job. But keep in mind, that's all a marketing tool for them to eventually sell a policy. And there's nothing wrong with that, but a lot of people don't like that built-in bias. A couple just name off the bat. There's a YouTube channel called Medicare School. They've done a great job. MedicareFAQ.com is a huge website, probably one of the biggest reference websites out there. Those are free resources. Paid solutions. So there are a couple vendors out there who do the video app-based or the learning management system type of courses that we're used to on the employer side. One-on-one counseling, not as common, but I have a background in that, and I am developing a solution for that one-on-one counseling and for the asynchronous video app-based approach as well, the more cost-effective of the paid resources. So if you want help with that or want to talk about a solution that way, reach out to me. But that is pretty much everything I can say with under 15, 20 minutes or so for HR folks to help employees with Medicare. Hope this has been helpful.